Right, let's talk now to Dr. Chris Purnell, a public health physician and an American College of Preventive Medicine fellow. Also with us is Dr. F. Perry Wilson, associate professor at Yale University School of Medicine. Great to have you both here. We appreciate it. Dr. Wilson, I was reading a tweet of yours. It's interesting. You write, when does the pandemic end? And you say, I think ending isolation requirements for those infected with COVID is a necessary and sufficient requirement to declare the end of the pandemic. To be clear, we can't do this yet, but it might not be far off.
Yeah, exactly. People are feeling, especially vaccinated, boosted, and relatively healthy people are really feeling the pain of 10 days of isolation. And the negative effect of that is that people actually are choosing not to get tested. Because
Right.
if you test positive, you know you're going to do well, but it really ruins all your plans. Now, that's a bad thing. That creates a bad incentive for people who are essentially doing all the right things during this pandemic. For it to feel like the pandemic is over, two things are going to happen. We're going to have to say, you know what, if you get COVID, you can go back into the world just like any other respiratory infection. But if we do that right now, we're going to overwhelm the hospital system. So I am asking people to buckle down as we ride this Omicron wave and get tested, even though, yes, it is onerous under the current isolation regime.
Right, but it protects people around you. I mean, ultimately,
it protects
that's
people,
so important.
who are unvaccinated primarily, yeah. And I think some vaccinated people are starting to get frustrated.
Fine,
that they're
but
spending
our little
time
kids,
protecting them.
and our little kids, right, Dr. Purnell? Our little ones who can't get it yet.
Yes, there are a host of factors, Poppy, that we have to think about. First and foremost, I want to say the pandemic is by no means over when we still have 1,200 people dying daily and we have case rates exploding because of this Omicron surge, especially in those hard-hit communities, in those rural spaces where testing and vaccination has not been on par where it has been in other parts of the country. And our kids, those who are not quite yet eligible to get vaccinated, and those who are eligible but their parents are not yet confident. I think what we need to do is to both understand the science and the data and understand how people socialize in human behavior and continue to be transparent and to help people understand how best to be vigilant and to protect themselves.
Mm-hmm. I want you both to listen to this from our reporter, Sarah Seidner. She spoke with a frontline healthcare worker who described what they're going through right now as a war zone.
To the point of it being almost unbearable. To see that. These are very good people, good respiratory therapists, good clinicians who want to do the best possible job, right? And they just can't. They can't do it.
I mean, Dr. Wilson, they're facing not only this continuing pandemic, but so much backlash from some of their own patients.
Absolutely. I've been taking care of COVID patients at Yale New Haven Hospital since the beginning of the pandemic, and there has been a shift, even in Connecticut, which is relatively highly vaccinated, from the sort of pre-vaccine era where there's a lot of, chance of heroism among healthcare workers, and now this strong backlash. We've also lost a tremendous amount of staff, nurses, and older physicians who have left practice entirely, or understaffed and starting to get overwhelmed.
If we could try to give people something to smile about amid a pretty tough set of news this holiday, I have to, Dr. Purnell, end with your retweet showing how well vaccines work against COVID. Here it is.
Heads up! Don't worry, Marv, I'll get him for you. Yes.
This is so appreciated in my household, where Home Alone is a nightly occurrence. And my son is Kevin. That is my son. He would do that to our house if he could. But seriously, you're trying to send quite a message there.
Yes, Poppy. You know, I've been talking about the need for people to be vigilant. I get it. We are fatigued. We are beleaguered, especially those of us in healthcare. But at the same time, we need to find ways to express to people in real world emotions what it means to be protected in this pandemic. And I thought the folks at Johns Hopkins did a fabulous job with doing that. What better way to reach into something that's a part of American culture and to say, hey, get yourself vaccinated so you can knock out the thugs. You can knock out Omicron.
It is so true. Well, thank you both for being here on this Christmas Eve, especially, and thank you for all you've done, both of you, for so long fighting this. We appreciate it very much.